Welcome everyone to another episode of Dr. Tade Talks. I am Dr. Tade. Today I'm joined by a very special guest, Dr. Ayo. Dr. Ayo is a family medical doctor who practices here in the US. His patients' population span across all cultures with a high population within the Hispanic community and Africans in the diaspora. This includes African Americans, Afro-Latinos, and Africans. Dr. Ayo has over 30 years of experience in family medicine, and I'm excited for him to share his wealth of knowledge with us today. Dr. Ayo is also my wonderful husband of almost 30 years. Welcome, Dr. Ayo.
Thank you for having me. I am really excited to be here, especially at a different scenario. Usually I'm home with her, but this time around we are doing some business together, and definitely medicine and mental health education is also a big part of my interest. So I'm glad to be here.
Today we're talking about coping with mental health in a pandemic world. According to the Our World in Data website, there have been over 400 million cases of COVID and over 5 million deaths worldwide. The New York Times has reported, as of the taping of this episode, that there has been over 76 million cases of COVID here in America since the start of the pandemic and over 900,000 deaths. The first case of COVID-19 arrived in America 2 years ago and has resulted in the worst pandemic in American history. This pandemic has been difficult for many of us, and we have seen the rise in numbers of people that have had mental health struggles as a result of the isolation, the death, the change in family life, loss of employment, or switch to remote work, which are all due to this pandemic. Our primary physicians and general practitioners, GPs as they are known in other parts of the world, are usually the first line of clinicians we see when we have a mental health issue, and we need a referral to a therapist if we don't already have a therapist. Dr. Ayo, as a primary care doctor who specializes in family medicine, what are some of the mental health issues you've seen in this pandemic period?
Oh, wow. Well, of course, we have seen an increased incidence in depression. Depression is very common in all ages, especially in the older population. But during the pandemic, we found that people in the ages 20 to 35, we saw more depression. And this is because there was a drastic reduction in socialization. They're unable to go to movie houses, to go to restaurants, the places where they socialize. And it's worse because they also lost their jobs. So the ones that were unemployed, you find that there's nowhere to go. The ones who have jobs are doing it from home. Right. So they are not going out. The ones that should be looking for a job are not able to go out and socialize. And it's even worse in the temperate region where we have the winter months. In the winter months, that's when mental illness is worse. And we saw more depression in that age group.
Yeah, that is so true. Depression, I mean, there's just been an increase. We've seen an increase in depression. Is there any other illness that you would see besides depression?
Of course, anxiety is another common problem that I have seen. And it's, you can say that the worst form that you have seen is agoraphobia, which is a fear of going outside. You now find a 25-year-old that has not been out in the past 3 months. And that's like unheard of pre-pandemic. But now there's a lot of them who have not been out. They're afraid of going out. So they're not even afraid of going to look for work or to engage in socialization. Of course, there are other things that we have noticed mentally. This is people who have mental disorders or some classification like the people with autism and other forms of developmental disorders who have not been able to go into their different therapies and their conditions are getting worse, or people with addiction problems. So you find that more people are drinking more, people are using more opiates, heroin and coal in the pandemic. So the pandemic had not done any good to whether it's medical, physical medical conditions or mental conditions.
Yeah, it's so true when you talk about, depression, how it affects all ages, So we're looking at even our children that are, going to school from home. They have to do the online schooling. It's really affecting everyone. The adolescents, they can't go to the movies. And then we have the young adults, a lot of them who have to work from home now. But then, so we're looking at all these age groups, even parents, people have lost their jobs. People have lost loved ones. So when people are feeling depression, a sense of depression, what are the signs that you want them to look for?
Of course, for individuals, if you find that you're not sleeping or sleeping too much, you're not eating or you're eating too much, or you find that you're just too irritable, simple things just make you snap at people, or you have, you're anxious on little things. You might even just be watching a simple movie and you find that you're crying. Or you just remember Auntie Jones and all of a sudden you're crying, and Auntie Jones had died 10, 15 years ago. These are all hidden signs of, simple signs of depression that one should immediately pick up and go and call up a physician or someone. And if you are a parent and you notice that your child is not participating in family things that you normally do, or they're just remote from everybody, not wanting to go out, you should be at an alert, and this should be a sign for you to call somebody.
Okay. So this is the best time for, and what that was going to be my next question about what are the signs that parents and loved ones should look for, in their children, in the people around them. So what you're saying is that when they are going through all of those symptoms, or when they are perceiving those symptoms in their loved one, that's when they need to make an appointment with their primary care physician,
Correct.
which is someone like you.
Correct.
Right? Okay.
Correct.
So after they've made this appointment, what should they expect when they get to their doctor's office? So you are the first port of call. You are the primary care physician. So they're not just going to call the therapist. They call their doctor.
Correct. I mean, as a simply call us the gatekeepers.
The gatekeepers.
Yes. So when you come in, we simply we assess you right from the moment that you are coming in. I'm already looking at your face. I'm making a joke and trying to see if you are smiling, or, are you my usual person? I once asked my patient before, the patient is sitting in front of me, and I said, where is my patient? Because this one is not my patient. Once you see things like that, then you're at alert. And after the physical exam, sometimes I will make them go through a clinical questionnaire, which I just, to save time, I will give to them on my iPad and walk out of the room, and I come back and I go through it, and that's kind of helped me to determine the kind, whether is it a mild depression, is it moderate, is it severe, how long it's been going on. It kind of gives me an idea by the time I look at the answers to the questionnaire that I gave them.